This is Dr. Michael Ryan, and I have a suggestion for people with a technique that I've stumbled upon myself in my practice and also my own personal life, since I have had a lot of leg cramps because I've had a vein condition for much of my adult life. And the technique is how to stop a leg cramp in about 15 seconds. You can do that during the day or in the evening or night when it wakes you up. The thing about leg cramps is that leg cramps associated with vein conditions and abnormal vein circulation almost always occur in the evening or at night. Occasionally, early in the morning as people are waking up, but usually it's at night. Very often it wakes people up, and the definition of a cramp is it's very painful. The cramp itself is a self-limited event, which means that the cramp will eventually die out and stop on its own without having to do anything. The problem with that is that the mechanism of dying out is extremely painful. The way it works in the body is that when the muscle is stimulated to fire uncontrollably without any feedback to stop, the muscle will squeeze and contract, and when it does that, it doesn't relax. It's what's called in the medical terminology a tonic contraction. When that happens, the muscle will convert its energy stores into lactic acid. The lactic acid itself is extremely painful, and that is the part of the pain that people experience when they have this continuous contraction of muscles. So how do you stop a cramp from happening before you get to that extremely painful phase? And cramps in the legs really are what I'm focusing on. The cramps can occur in the feet, in the calf, or in the thigh. So this technique can actually help all of these, and it's a surprise to me that it does help in all these areas. One of the things about a cramp also to know is that a cramp only occurs in a muscle that is not being stretched. It's what we call flaccid. It's as opposed to being stretched out. So this would be a flaccid muscle. This is a stretched muscle. So the flaccid state of the muscle is the moment when a cramp will occur. And that also suggests some of the reasons that this other technique that I have stumbled upon is helpful. And the technique involves self stimulation of the tendon receptors in your leg. And the tendon receptors in your leg are designed to actually protect the tendon from overuse. The tendon is the most delicate, weakest part of the what we call the tendon muscle complex. And the tendon will easily tear before the muscle does. And so the tendon has a receptor. The receptor will start firing to inhibit the contraction of the muscle because it will generate pain. So this tendon reflex is what the principle of this technique is based upon. So I'll show you on my leg. And by the way, I've done this to myself in the middle of the night when I've had cramps. It works. I've also treated patients, and in my practice, people will be laying on the treatment table, and all of a sudden they'll have a cramp, and I perform this maneuver, and the cramp stops in about 15 seconds. So I've done it enough times to know that it's reproducible. There are a couple of important points. First of all, you have to find the tendon. There's a tendon. These are your hamstring tendons, and they're behind your knee. There's one on the side here. There's one on the outside, and there's one on the inside. And you can reach under there and feel the tendons. They're bands that go into the knee area. And those tendons are the ones that you want to grab onto. The important principle is when you're doing this maneuver, which is basically you're squeezing the tendon as hard as you can without causing damage. It has to be uncomfortable, not painful, but uncomfortable. So you're squeezing on the tendon and pulsing it and making it uncomfortable. It has to be uncomfortable. And if you don't have strong enough hands to do that, this technique won't work. You may need to have your spouse or a significant other who's available at the spur of the moment to help you. Because if you wait more than a couple minutes, it'll be all over. The cramp will have ended itself. But you want to reach down there and grab these tendons and then squeeze, and it has to be uncomfortable, not painful, uncomfortable. Uncomfortable means that there is enough negative stimulation of those tendon receptors that it's going to send a feedback message by your uh, nerve circuitry to your spinal cord, and what will happen is the muscle will stop. Now, also, what's helpful to do when you're grabbing onto your tendons and squeezing is straighten your leg out. Or if it's your foot, see if you can pull your foot back, because that will put the muscle, change it from its flaccid, non contracted state to a more stretched out state. This maneuver, if you're in bed at night, I would suggest that you uh, get in bed and imagine you're having a cramp. What are you going to do physically when that happens? You may have to swing up and swing your legs over the side of the bed. You may be able to do it sitting up, but you're going to have to get an idea how are you going to be able to sit up and get enough pressure on those tendons so that it's uncomfortable. When you're squeezing on your tendons there, if you straighten your leg out completely, the tendons disappear. So your leg has to be slightly bent so you can feel the tendons. You have to be able to feel the tendons to really grab onto them. If it's completely flat and straightened out, the tendons disappear in the tissues and you really can't do this maneuver. So you have to, you're going to wake up. Of course, when you wake up with a cramp, you're awake instantly because it's so painful. But you have to have an idea physically, how are you going to do it? If you're laying on your back, are you going to be able to reach down there and do that? That might be, it's somewhat awkward. So for myself personally, what I do is I sit up and I'm able to do it sitting up in bed. If you're having trouble sitting up, then you may have to swing your legs over the side of the bed. Now, when I see patients in the office and they have a cramp during a treatment, they're laying flat on the treatment bed, and I will just reach down there and squeeze their leg. I try to straighten their leg out as much as possible. The cramp goes away usually right away. That doesn't mean the cramp won't come back. When you're in a state where there's a tendency to have cramps, the cramps tend to recur. And so when you get yourself out of a cramp, you want to make sure that you don't get into the flaccid state again. You get your leg straight and stretched out, and that will help prevent the cramp from coming back. So Dr. Mike Ryan with a technique to stop a leg cramp in 15 seconds.